helping make your life easier. Moms every day.
Allergic rhinitis can occur seasonally or year-round. It's otherwise known as hay fever, with sneezing, runny nose, and itchy eyes. Michael Sullivan is an allergist with Allergy Asthma and Immunology Associates. Nice to have you here today, doctor.
Thank you. Thanks for having me here.
Yeah, so how common is allergic rhinitis? How many people get it?
Allergic rhinitis is very common. 20% of Americans have allergic rhinitis. It's the most common disease of childhood.
Oh, but it can occur anytime.
It can occur anytime, 0 to 100. That's
All right.
correct.
So how would you know if you had it?
Typically, you have the symptoms that you mentioned: itchy, watery eyes, sneezing, runny nose. It can occur in the spring or the summer or the fall or even the wintertime. You differentiate it from a cold by not having a fever, by not having discolored mucus, and typically it responds to allergy medication, whereas a cold does not.
Can your symptoms vary from person to person? I know some people will get postnasal drip.
Absolutely. There's marked variation, marked individual symptoms, and different precipitating factors for everybody.
Okay, so how do you diagnose this? If someone has these symptoms and they think, oh, is it a cold, is it allergies, how would you diagnose it?
So there are several things. So you ask the patient the symptoms, and if their symptoms are consistent, you look at them and you can see allergic shyness potentially below their eyes. You look at the nose, see congestion. There's other manifestations of allergies, so there's history is important. Physical is important, that examination. Often we do allergy testing where we put little tests on someone's back and identify the allergen.
Is that with all the needles in the back?
That's with the little needles on the back. Actually,
Right.
we use little plastic things. We've kind of got away from needles and do more plastic stuff now.
All right, and then you'll see what they are allergic to.
See what they're allergic to, and then we talk about therapy, which can consist of prevention, can consist of medication, and can consist of allergy shots.
Okay, so allergy shots, how do those work, and how often do you have to have them?
They build up your immunity. So if you get a tetanus shot, you build up immunity so you don't get tetanus. And so if we give you ragweed, you build up your immunity so ragweed doesn't cause problems.
All right, will it go away?
80% of people have a marked response with allergy shots.
Oh, they do, that high?
Yes.
Will you have to take the shots for like a year?
You typically take them for 3 to 5 years.
3 to 5 years?
That's right.
Just have to be patient then with it.
Have to be patient. Typically people have allergies for many years. If you're an adult with allergies, there's 80% chance you're going to have them lifelong.
Okay, and then you have over-the-counter medications.
There's lots of good over-the-counter medications. One of the problems with over-the-counter medicine is they can cause sedation. So some of the sedating medicine impairs you more than if you're legally drunk. So we have to be very careful with over-the-counter medication. So there's non-sedating over-the-counter antihistamines, which are very safe. There's over-the-counter nasal steroids, which are helpful. And there's a host of other medications that are available.
Perfect. Doctor, thank you.
Thank you, ma'am.
All right, and for more information on Allergy, Asthma, and Immunology Associates, visit momseveryday.com.